On to another kidney condition. We've got Alport Syndrome. So this is the case of a 33-year-old female with microscopic hematuria that started at age 12. She has a strong paternal family history of clinically diagnosed Alport syndrome, and she herself has no vision or hearing loss. And we'll go through her family history next. But just to highlight what's going on in Alport syndrome from a genetic standpoint, there are 3 genes that are primarily associated with Alport syndrome. The X-linked formed, but as well as both recessive and dominant inheritance patterns. And I bring this up because it gets really tricky. You've got genes that the same gene can cause both a recessive and a dominant inheritance pattern. And it can be quite tricky to understand how your patient in that family may be affected by particular variants. So looking at this family tree, you see our proband, or the patient here, is the 33-year-old with the arrow who has hematuria. She has a brother with hematuria as well. Her father passed away at age 51. He was blind in his teens, had hearing loss that developed in his 30s, end-stage renal disease in his mid-30s, and renal transplant before age 40. He has 4 siblings, 3 who are deceased at younger than age 50, and all presented with similar findings as himself. Interestingly, his parents were both asymptomatic throughout their life. And in fact, his mother, who is 100 years old and doing well, has 4 children with another partner who are unaffected. So the genetic testing here did identify a variant in Col4A3. And again, this is one of those tricky genes where it's hard to know whether or not there's a dominant or a recessive inheritance pattern for this variant, as both patterns have been reported. So Alport inheritance is one of the more challenging ones to understand. There can be reduced penetrance and variable expressivity, meaning that not every individual in the family presents the same, even if they have the same variant. Individuals with heterozygous Col4A3 variants can have benign hematuria and be considered carriers for autosomal recessive Alport syndrome. And patients' relatives, paternal relatives in this case, had an earlier onset disease more consistent with an autosomal recessive pattern, whereas our patient fit maybe more as a carrier or as more of the dominant form. It is possible that there may be more severely affected family members having a second variant in the Col4A3 gene, or it's been postulated that there can be a second variant in another gene, such as Col4A4, resulting in something called digenic inheritance. This is where 2 different genes that really work closely together can each have a change, and those things can combine and have a confounding effect.